Hello and welcome. I'm here today to take you through some of the significant HSE achievements. 2009 has been a very demanding year for us. The HSE team faced numerous challenges to ensure a safe, reliable operation. One of the challenges was the completion of more than 100 actions from the Safety and Operation Audit, which has overhauled the HSE management system. Several new HSE team members have joined us this year, and they managed to gel in very quickly. The new energized team delivered extraordinary performance for the entire organization. Let me give you a quick look on how we performed throughout the year. Our HSE performance shows positive indicators, as you can see from these graphs. As a result of so many risk reduction activities, our indicator rates have started declining. The biggest headline this year for us, the completion of 3 million man-hours and 3 years without days away from work case.
The year 2009 is a landmark year when it comes to implementing the health agenda in BP Sharjah. Based on the BP Group guidelines, various components of our health management system were remarkably improved. We started with the basics. Using the health map tool, various risks associated with the operations are identified and prioritized, and different programs were developed accordingly. The focus remains on enhancing our medical capabilities, with Sharjah Plant Clinic being upgraded and equipped to respond to all sorts of medical emergencies. There is now a structured food monitoring program in place, with all the relevant staff being trained in advanced skills and food safety audits. This year we have completed our fitness to task medical examination program, with all the operations staff being medically checked for fitness against their assigned task. And finally, pandemic. With swine flu striking across the globe, we have made some significant efforts in updating regarding the current situations and educating our staff on the precautions.
2009 is also a significant year for Sharjah PU in terms of traction action closure, HSCMS procedures and policies, and the successful launch of CTM. As you can see the graph of 2009 performance versus 2008 performance, this was achieved because of the proactive intervention from the PU leadership and active support from the HSE team. This year we had major changes in HSCMS procedures, with 48 HSE related procedures and policies reviewed and reissued. These procedures and policies were rolled out to all Sharjah PU personnel and placed in Documentum. Compliance Task Manager, or CTM, is a new tool that we rolled out in fourth quarter of 2009.
Training and awareness are critical and fundamental parts of HSE management system. We manage HSE risks through regular inductions, hazard awareness, safety immersions, defensive driving, and fatigue and tiredness training, so that our trained workforce can do their jobs safely. One key activity that we did in 2009 was a comprehensive survey of ladders against BP Engineering Recommended Practice, RP4. Hundreds of ladders across all BP Sharjah sites were surveyed, and we identified various areas of improvement.
Industrial hygiene was also one of our major accomplishments this year. An asbestos register and risk assessment has been completed, and a management plan is under implementation to control exposures to this hazardous substance. An inventory of over 300 chemical substances, their associated hazards and storage requirements was completed as a prerequisite to building our electronic material safety datasheet database. Following a risk assessment on our water systems, we have a plan in place to eliminate conditions that favour Legionella growth and exposure to this hazardous bacteria. Also, a programme of benzene and noise monitoring has been established. The monitoring data collected will help us build risk-based control programmes. Our respiratory protective equipment programme was rolled out, and BP Sharjah also hosted the Fundamental Principles of Industrial Hygiene course, attended by delegates from Middle East and Pakistan and North Africa SPUs.
One of the strategies that HSE had in place this year was to look into the review of inputs and outputs. Ultimate objectives were risk reduction and accident prevention. eSafe, SOC, and accident data were used as a starting point to derive common theme and attention areas. We started on a monthly trend analysis, and we're currently working on a methodology to ensure that our workforce are engaged in the identification of required interventions. Further scrutiny was also initiated into the HSE inputs and outputs to certain other improvement areas, such as eSafe system review, eSafe closure monitoring, and others.
Our goal is to protect the environment and prevent pollution by demonstrating best practices, mechanism, and procedures. BP Sharjah is committed to work towards the ISO 14001 by demonstrating continuous improvement in environmental performance and complies with the regulation. We will continue to drive down the environmental impact of our operations by reducing waste discharges and emissions. The benzene emissions levels in 2009 compared to the previous years were significantly reduced, as can be seen in the graph.
In year 2000, we had a major condensate spill at the Hamria condensate terminal. In the initial years, we recovered some condensate from soil. Currently, a complete project is being worked out to recover most of the remaining condensate from groundwater and soil. You can see an array of wells drilled to understand the spread of oil in the aquifer. It's like exploring a small oil field. Soon we will be moving in the executive stage of the project to pump out oil and remediate groundwater where contamination took place. Non-compliance with HSE regulatory requirement is considered one of the major risks BP group-wide. The laws and regulations are often complex, in many cases vague, and subject to interpretations. We have now a compliance task manager to help us out manage our HSE regulatory requirements. CTM is up and running in Sharjah PU, and most of us are part of it. This is one of the key HSE achievements for the Sharjah PU in 2009.
As you have seen, this year was full of challenges and accomplishment. Year 2010 will be no different from challenges point of view. But we have proven time and again that we are able to deliver excellent performance. With due diligence, firm dedication and commitment to high standard of work, we always emerge stronger, better and safer than before. Thank you for watching.